Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Transphenoidal Tumor Resection. Introduction. A tumor of the pituitary gland is a serious disease that affects many body functions and can cause vision problems, among other symptoms. Because the pituitary controls many hormones, a tumor there may interfere with body functions such as growth, weight gain or loss, and sexual drive. Doctors may recommend surgery to remove a pituitary tumor. If your doctor recommends surgery, the decision whether or not to have surgery is yours. This patient education module will help you understand the benefits and risks of this surgery. Anatomy. The pituitary gland is located at the base of the brain just behind the nose. The pituitary gland is very important because it controls most hormones. This picture shows various glands of the body. A tumor is an abnormal growth of tissue in the body. A pituitary tumor can be identified by an MRI because it occupies more space than a normal pituitary gland. Symptoms and their causes. The symptoms of pituitary tumors vary widely. They depend on how your hormone levels are disturbed. Increased levels of growth hormones in children can lead to gigantism or excessive growth in height. In adults, this can lead to an increase in the size of the hands and feet, and sometimes parts of the face, along with high blood pressure and possibly sugar diabetes. The thyroid hormone is under the control of the pituitary gland. Excess thyroid production may cause hyperactivity and weight loss. Decreased production can lead to excessive tiredness and weight gain. Decreased levels of sex hormones can lead to decreased sexual desire and ability, even causing impotence. High production of corticosteroid hormones can cause high blood pressure, obesity, sugar diabetes, and other problems. Low production of these hormones can cause low blood pressure and inability to fight infections. Increased production of the hormone prolactin may lead to irregular menstruation or inappropriate production of breast milk in women. In men, it may lead to a decrease in sexual interest and ability. Low levels of the hormone ADH can keep the kidneys from holding on to water, leading to too much urination and loss of water needed by the body, or dehydration. Finally, if a large tumor grows in the pituitary, it may press on the optic nerves, which connect the eye to the brain, since the pituitary gland's position at the base of the skull is just beneath the optic nerves. This can cause vision problems. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Alternative treatments. Some tumors can be treated with medications that shrink the tumor. Such medications must be taken for a long time, sometimes for life. If the medication has harmful side effects, an operation may be necessary. A small tumor, which is not producing any hormones, may not require an operation. MRIs should be taken repeatedly to make sure the tumor is not growing. If a tumor cannot be treated with medicine, or if it is large and presses on other body tissues, then an operation may be advisable. Surgical treatment. The operation is done under general anesthesia. The tumor is usually approached through the nose from under the upper lip. Sometimes the tumor can be approached through the nose itself using special scopes. Once reached, the tumor is removed. The tumor is sent to a pathologist to see if it is cancerous. The surgeon takes out as much of the tumor as is safely possible. During the operation, fluid from around the brain may leak from the surgical site. When this occurs, the surgeon removes fat and muscle from the patient's abdomen and uses the tissue to pack the area. This stops the leak. Some surgeons regularly pack the area whether or not a leak has occurred. After the operation, the lip incision is closed and the nose is packed with gauze. After waking up from anesthesia, the patient will not be able to breathe through his or her nose. The nose will be sore and the patient may have a big headache. After surgery, urine will be watched closely. If too much water is lost, medication will be given to control it. Risks and complications. This operation is safe. There are, however, several possible risks and complications. You need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early. The risks and complications include those related to anesthesia and those related to any type of surgery. Risks of general anesthesia include nausea, vomiting, urinary retention, cut lips, chipped teeth, sore throat, and headache. More serious risks of general anesthesia include heart attack, stroke, and pneumonia. Your anesthesiologist will discuss these risks with you and ask if you're allergic to certain medications. Blood clots in the legs can occur due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. It is extremely important to let your doctors know if any of these symptoms occur. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of blood clots in the legs. Some of the risks are seen in any type of surgery. They may occur at the lip incision or in the abdomen where the fat and muscle are removed. They include 1. Infection deep in the head or abdomen or shallow at the skin level. 2. Bleeding. 3. A scar that may be painful or ugly. Other risks and complications are related specifically to this surgery. These are also very unlikely, however, it is important to know about them. The nose may be injured as the doctor goes through it to reach the pituitary gland. Tissues around the pituitary may be injured. These include the optic or other eye nerves, possibly leading to blindness or double vision. When the tumor is attached to the optic nerves or blood vessels, it is better to leave part of it than risk damaging the optic nerves and blood vessels. Big blood vessels may be injured, possibly causing strokes and a need for a blood transfusion. In very rare cases, this may lead to death. Fluid may leak into the area of the operation, requiring another operation to repack the site. An infection of the brain may occur. Brain infections are called meningitis. The chance of any of these complications happening is very low. Most of the tumors are not cancerous. However, they may grow again, requiring another operation. Sometimes radiation therapy is needed if the tumor is invading the blood vessels and the nerves at the base of the skull. Hormonal deficiency can occur either because of the tumor itself, its resection, or future radiation therapy. If this happens, you may need to take hormones for a long time. After the surgery. After the surgery, you will probably spend a few days in the intensive care unit, ICU, depending on how well you are doing. The nurses in the intensive care will watch you carefully. This involves the repeated checking of your urine and neurological status, such as vision and awareness. If the urine checks show that your kidneys are unable to retain fluid, you may have what is known as diabetes insipidus. Initially, IV medication can be used to control that problem. If the problem persists, then a nasal spray medication may be needed for long-term control. After surgery, you should avoid heavy lifting, any kind of straining and bending, and you should avoid blowing your nose. Report to your doctor if you notice a clear, salty liquid dripping from the nose, fever, or a severe headache. These could indicate complications. Also report possible signs of hormone deficiency, such as nausea, dehydration, excessive urination, tiredness, low blood pressure and dizziness, weight gain, and cold intolerance. Hormone therapy may relieve such conditions. This picture shows various glands of the body. This will help you recognize the various symptoms associated with low levels of hormones. Whether or not you will be able to resume your usual activities depends on how well you are doing at the time of your follow-up visit to the doctor. Your doctor will tell you how long it will take before you are healed and if and when you can go back to work. This depends on your age, type of work, and medical condition, as well as the kind of tumor you have and whether you will need further therapy.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Surgery to remove a pituitary tumor can relieve many serious symptoms in children and adults. It can even be life-saving. This surgery is generally quite safe. However, as you have learned, complications may still happen. Knowing about them will help you detect them early if they happen. Thank you for using Explain.